Well, thank you so much, Mr. Speaker. It's a real pleasure for me to stand once again today to speak on this very important bill, Bill C-64. Bill C-64 is an act representing Pharmacare. It contains three key sections, Mr. Speaker. It is, one, it establishes a framework towards a national universal pharmacare in Canada for certain prescription drugs and related products. Two, it provides that the Canadian Drug Agency work towards the development of a national formulary to develop a national bulk purchasing strategy and support the publication of a pan-Canadian strategy regarding the appropriate use of prescription medications. And finally, the third section is that within 30 days of hopefully this bill receiving royal assent, the minister would establish a committee of experts to make recommendations regarding the operation and financing of national universal single-payer pharmacare. So, Mr. Speaker, this bill, along with other investments made by our government, will help millions of Canadians who are struggling to pay for their prescription drugs. Since this bill was introduced, we have heard many facts about access and affordability of prescription drugs within Canada. We know that Stats Canada data from 2021 has indicated that 1 in 5 Canadians reported not having enough insurance to cover the cost of prescription medication in the previous 12 months. We know that having no prescription insurance coverage was associated with higher out-of-pocket spending and higher non-adherence to prescriptions because of cost. We know that this results in some Canadians having to choose between paying for these medications or for other basic necessities like food and housing. This is why we have consistently made commitments towards national pharmacare and have focused efforts on the key areas of accessibility, affordability, and appropriate use of medications. Let me start with the Pharmacare Act, Mr. Speaker, which references the foundational principles of access, affordability, appropriate use, and universality. We've heard a lot about all of these four principles this evening, but it's important to continue this conversation. Bill C-64 recognizes the critical importance of working with provinces and territories that are responsible for the administration of healthcare. It also outlines our intent to work with these partners to provide universal single-payer coverage for a number of contraception and diabetes medications. This legislation is an important step forward to improve health equity, affordability, and outcomes, and has the potential of long-term savings to the healthcare system. In our most recent budget, Budget 2024, we announced $1.5 billion over 7 years to support the launch of national pharmacare and coverage for contraception and diabetes medications. Mr. Speaker, I'd like to highlight the potential impact the two drug classes for which we're seeking to provide coverage under this legislation will have on Canadians. We've heard of stories or know of someone in our constituency who's struggling to access diabetes medications or supplies due to lack of insurance coverage through their work, or of an individual that has limited insurance coverage so cannot choose the form of contraception that is better suited for her. For example, a part-time uninsured worker who has type 1 diabetes and is also of reproductive age. For this individual to manage her diabetes, it would cost her up to $18,000 every year, leaving her potentially unable to afford the $500 upfront cost of her preferred method of contraception, hormonal IUD. With the introduction of this legislation, this individual will save money on costs associated with managing her diabetes and will be able to access a hormonal IUD at no cost with no out-of-pocket expenses once implemented in her province. Studies have demonstrated that publicly funded, no-cost universal contraception can result in public cost savings. Evidence from the University of British Columbia estimated that no-cost contraception has the potential to save the BC healthcare system approximately $27 million per year, Mr. Speaker. Since April 1st, 2023, BC is the only province in Canada to provide universal free contraceptives to all residents under the BC Pharmacare program. In the first 8 months of this program, more than 188,000 people received free contraceptives. That is wonderful. With respect to diabetes, it is a complex disease that can be treated with safe and effective medications. 1 in 4 Canadians with diabetes have reported not following their treatment plan due to cost, Mr. Speaker. So improving access to diabetes medications will help improve the health of some of the 3.7 million Canadians living with diabetes and reduce the risk of serious life-changing health complications such as blindness or amputations. Beyond helping people with managing their diabetes and living healthier lives, if left untreated or poorly managed, diabetes can lead to high and unnecessary costs on the healthcare system due to diabetes and its complications, including heart attack, stroke, and kidney failure. The full cost of diabetes to the healthcare system could exceed almost $40 billion by 2028, as estimated by Diabetes Canada. The bill demonstrates that the Government of Canada's commitment to consulting widely on the way forward and working with provinces, territories, Indigenous peoples, and other partners and stakeholders to improve the accessibility, affordability, and appropriate use of pharmaceutical products by reducing financial barriers and contributing to physical and mental health and well-being. Mr. Speaker, beyond our recent work under Bill C-64, I'd like to highlight maybe 1 or 2 initiatives, depending on my time, that this government has also put in place to support our efforts towards national pharmacare. On a national level, our government has launched the first ever national strategy for drugs for rare diseases in March 2023, with an investment of up to $1.5 billion over 3 years. As part of the overall $1.5 billion investment, our government will make available up to $1.4 billion over 3 years to willing provinces and territories through bilateral agreements. This funding will help provinces and territories improve access to new and emerging drugs for Canadians with rare diseases, as well as support enhanced access to existing drugs, early diagnosis, and screening for rare diseases. I'd also like to highlight another initiative underway, which involves the excellent work by PEI through a $35 million federal investment. Under this initiative, PEI is working to improve the affordable access of prescription drugs, while at the same time informing the investment of national universal pharmacare. The work accomplished by PEI has been remarkable. Since December of last year, PEI has expanded access to over 100 medications to treat a variety of conditions, including heart disease, pulmonary arterial hypertension, multiple sclerosis, psoriasis, and cancer. In addition, effective June 1st, 2023, PEI reduced copays to $5 for almost 60% of medications regularly used by island residents. I am pleased to share that through this initiative, PEI residents have saved over $2.8 million in out-of-pocket expenses as of March of this year. Finally, Mr. Speaker, on December 18 of 2023, the Government of Canada announced the creation of Canada's Drug Agency with an investment of $89.5 million over 5 years, beginning this year. Built from the existing Canadian Agency for Drugs and Technologies in Health, and in partnership with provinces and territories, the CDA will provide the dedicated leadership and coordination needed to make Canada's drug system more sustainable and better prepared for the future, helping Canadians achieve better health outcomes. I am pleased to share that as of May 1st, CADTH has officially launched as Canada Drug Agency. In closing, Mr. Speaker, because I know I've run out of time, you could see the extraordinary amount of work that has been dedicated to and will continue to be dedicated to our commitments related to national pharmacare that focuses on accessibility, affordability, and appropriate use of medications. Bill C-64 represents the next phase of helping Canadians receive the medications they need, and we look forward to working with all parliamentarians to ensure its successful passing. Thank you so much, Mr. Speaker.
Thank the Honourable Member from Davenport. And I see that the Honourable Member from Calgary-Shepherd is rising to ask a question and questions and comments.
Thank you, Speaker. So the member did mention rare diseases, and I can't afford the opportunity not to get up to clarify a couple of things. It's only mentioned once in Section 5 of the legislation. And to all my constituents back home and all the rare disease organizations and patients across the country, not a single person will have their rare disease drugs paid for by this legislation. Not a single one. It is not in the legislation. The 2023 announcement that they just made is a re-announcement of their 2019 announcement. I hear the NDP caucus is heckling me once again, and I know they're really upset when I raise this. This government is the one that actually canceled the original rare disease strategy in 2016. And at the time, the head of the organization called it the kiss of death for rare disease patients. Does that member agree?
The honourable member from Davenport.
Thank you so much, Mr. Speaker, and I want to thank the honourable member for his question. Look, you know, Bill C-64 is establishing the framework of a national universal pharmacare program here in Canada. It is phase one of the program. It includes prescription drugs and free coverage for contraceptives and diabetes medication. I think we're hoping to expand the program. And then in addition, there's some additional elements that's going to help complement the National Pharmacare Program, and that indeed is our national strategy for drugs for rare diseases. I think, again, it's starting with a $1.5 billion over three-year investment, and I believe that our intention is that we will be expanding it in the years to come. Thank you, Mr. Speaker.
The honourable member from l'honorable député de Terrebonne.
The honourable member for Terrebonne. Thank you, Mr. Speaker. My question may be a simple one, but I think it's also quite complex because I never got a clear answer from the federal government. Why do they think that they can better understand Quebecers' needs than the government of Quebec, that it runs a pharmacare plan that has been in existence for a number of years? Thank you.
The honourable member from Davenport.
Thank you so much, Mr. Speaker. My response to the honourable member for her question, this is a national pharmacare program. We know that there are a number of provinces that offer different levels of pharmacare support right now. And so what we're trying to do is provide a national pharmacare program based on the four principles that we have been consistently talking about. So that's universality, accessibility, and I'm forgetting the four principles. Oh, here, principles of access, affordability, appropriate use, and universality. And so what we're trying to do is move beyond just BC and Quebec and PEI and make sure that there is access, accessibility, and appropriate use and universality for all Canadians. Thank you, Mr. Speaker.
The honourable member from Courtenay, Alberni.
Speaker, I find it pretty rich when Conservatives start talking about expanding pharmacare when they're doing everything they can to block it, Mr. Speaker. 3 years ago, they voted against pharmacare. They could have brought forward amendments to include an expanding that would cover people with rare diseases. They didn't do that. In fact, they're saying that people are already covered. I'll tell you about Becky in my riding. She cites our out-of-pocket costs for my son's insulin and devices came to just over $11,000 per year. It's so expensive, sometimes the pharmacy calls me to give me a heads up about how much an order will be, as if we have an option. Without it, he will die. So something like National Pharmacare would be a game changer for us. So through you, Mr. Speaker, maybe my colleague can talk about, would she be willing to work with the NDP and the Conservatives if everybody came together and wanted to include rare diseases? Because you know there's a willing partner right here.
The honourable member from Davenport.
Thank you, Mr. Speaker. I want to thank the honourable member for his question. I want to also thank him for his commitment and his passion to the National Pharmacare Program. I'll say to you, in my riding of Davenport, having a National Pharmacare Program is very popular. They're very excited with Phase 1 and the introduction of diabetes medication being covered as well as contraceptives. And so I know that they're looking for an expansion of this program, and I know that's something I'm very interested in as well. Thank you.
A very short question from the honourable member from Ottawa Centre.
Thank you very much, Speaker. I thought you were talking about my height, so I will keep it nice and tight. I know the member from Davenport has been a long-time supporter of Pharmacare, and just like me, she's campaigned on this. I just want to know from her the impact of this legislation on her community.
The honourable member from Davenport has 15 seconds.
I want to thank the honourable member for his question. I want to also thank him for his leadership on the Pharmacare Act, so thank you. I'll say to you that the impact on my community will be huge. It's particularly very popular within the senior population, but I know that it's something that will be very helpful. With the